Ever wondered what escitalopram is and why it's vital for your board exam preparation? Let's embark on this journey of exploration. Escitalopram, a term you might have come across in your studies, holds a significant place in the realm of psychiatry. It's a name that's important not just for your understanding of psychiatric medication but also for your board exams. Escitalopram belongs to a class of drugs known as selective serotonin reuptake inhibitors, or SSRIs for short. Now what does that mean? In the simplest of terms, SSRIs like escitalopram help increase the level of serotonin, a neurotransmitter in our brains associated with feelings of well-being and happiness. By inhibiting or blocking the reuptake of serotonin, these drugs allow more of this feel-good chemical to be available in the brain. You might also know escitalopram by its trade name, Lexapro. It's the same medication, just under a different name. The pharmaceutical industry often uses trade names for marketing purposes, and Lexapro is the name you'll often see on the prescription pad. So why is escitalopram so important in psychiatry? Well, its ability to modulate serotonin levels makes it a potent tool in the treatment of various mental health disorders such as depression and anxiety disorders. Its efficacy and relatively mild side effect profile have made it a preferred choice among many mental health professionals. And why is it relevant for your board exam preparation? The answer is simple. A comprehensive understanding of psychiatric medications like escitalopram is crucial for any aspiring psychiatrist. You'll not only need to know how these drugs work but also when to use them and what potential side effects to look out for. Escitalopram, being a commonly prescribed SSRI, is likely to feature in your board exams, and a thorough understanding of this drug will certainly give you a leg up. So now you have a basic understanding of what escitalopram is. Ready to dive deeper? So what are the key concepts you need to understand about escitalopram? Escitalopram, marketed under the brand name Lexapro, belongs to a class of drugs known as selective serotonin reuptake inhibitors, or SSRIs. The primary function of this class of drugs is to increase the amount of serotonin in the brain. Now you may be wondering, what is serotonin and why is it so important? Well, serotonin is a neurotransmitter, a type of chemical that helps transmit signals in the brain. It's often referred to as the feel-good neurotransmitter because it contributes to feelings of well-being and happiness. However, its role is much more complex than that, as it helps regulate mood, anxiety, sleep, and even appetite. When the levels of serotonin are low, it can lead to feelings of sadness, anxiety, or difficulty sleeping, among other symptoms. This is where escitalopram comes into play. By blocking the reabsorption of serotonin in the brain, escitalopram increases the amount available. This helps maintain a mental balance, which can alleviate the symptoms of depression and generalized anxiety disorder. One of the unique characteristics of escitalopram is that it's more selective than other SSRIs. This means it primarily affects serotonin and has less impact on other neurotransmitters. This selectivity is what makes escitalopram a popular choice among healthcare providers, as it can reduce the likelihood of certain side effects. Remember, while escitalopram helps to balance serotonin levels in the brain, it doesn't create more serotonin. The body must produce this naturally. Therefore, it's crucial to maintain a healthy lifestyle alongside medication, incorporating elements such as a balanced diet, regular exercise, and sufficient sleep. It's also worth noting that the effects of escitalopram, like many psychiatric medications, are not immediate. It may take several weeks for a person to start experiencing the full benefits, so patience is key during this period. With these key concepts in mind, understanding the uses of escitalopram becomes much easier. Now that we understand the key concepts, what are the uses of escitalopram? Escitalopram, more commonly known by its brand name Lexapro, is a medication that belongs to the selective serotonin reuptake inhibitor, or SSRI, class of drugs. It's primarily used to treat two mental health conditions, major depressive disorder and generalized anxiety disorder. Let's take a deeper dive into how escitalopram works for these conditions. In the case of major depressive disorder, escitalopram can be a beacon of light at the end of a long, dark tunnel. Depression can manifest itself in a myriad of ways, including persistent sadness, loss of interest in activities that once brought pleasure, and constant fatigue. Escitalopram works by restoring the balance of serotonin, a natural substance in the brain that helps maintain mental balance. By doing so, this medication can help improve mood, increase energy levels, and stimulate a renewed interest in life. Now let's move on to generalized anxiety disorder. This is a condition characterized by chronic, excessive worry and fear that can interfere with daily activities. Escitalopram can be effective in managing symptoms of generalized anxiety disorder. It helps by reducing the excessive worry and restlessness and promoting a sense of calm and well-being. It's important to note that while escitalopram can help manage these conditions, it doesn't cure them. It's a part of a broader treatment plan that may also include psychotherapy or other therapeutic approaches. Also, remember that the effectiveness of escitalopram isn't immediate. It often takes a few weeks to feel the full benefits of the medication. So, patience is key when starting on this treatment journey. In conclusion, escitalopram is a medication that can significantly improve the quality of life for individuals suffering from major depressive disorder and generalized anxiety disorder. It works by boosting mood, increasing energy levels, and instilling a sense of calm. So, escitalopram is a powerful medication with significant benefits, but remember, it also has potential side effects. Understanding possible side effects is crucial. So, what are the side effects of escitalopram? Now, the side effects of any medication are a critical piece of the puzzle when it comes to understanding its overall effect on the body. So, let's dive right into the potential side effects of escitalopram. One of the most common side effects that patients report is nausea. This can make it difficult for some people to continue taking the medication, but it's important to note that this usually subsides after the first few weeks of treatment. Dry mouth is another common side effect. Staying hydrated and using a humidifier at night can help manage this. Trouble sleeping is another potential side effect, which could manifest as insomnia or disrupted sleep patterns. If this becomes a persistent issue, it's crucial to bring it up with your healthcare provider. Constipation, tiredness, and drowsiness are also possible side effects. These might make it challenging for some people to go about their daily activities. If these symptoms persist, it's important to seek medical advice. Sweating and weight changes have also been reported. In some cases, patients may experience weight gain, while others may lose weight. It's important to maintain a balanced diet and regular exercise routine, but if weight changes are significant, consult with a healthcare provider. Now, let's talk about the more serious side effects, which are less common but crucial to be aware of. These include decreased interest in sex and changes in sexual ability. If you experience any of these symptoms, it's essential to discuss them with your healthcare provider. Another serious side effect is easy bruising or bleeding. This could be a sign of a decrease in the number of platelets in your blood, which is a serious condition that requires immediate medical attention. In conclusion, while these side effects can sound daunting, it's important to remember that not everyone experiences them, and they often subside after the first few weeks of treatment. It's crucial to be aware of these side effects, as they can impact a patient's willingness to continue treatment. Now let's recap what we've learned about escitalopram. We've traversed the landscape of this essential psychiatric medication, escitalopram, also known as Lexapro. It's a fascinating journey, isn't it? We've explored its classification, uses, mechanism of action, and side effects. Escitalopram falls under the category of selective serotonin reuptake inhibitors, or SSRIs for short. As we've discussed, SSRIs are a cornerstone in the treatment of various psychiatric disorders, and escitalopram is no exception. It's a key player in the arsenal of tools that mental health professionals use to combat the debilitating effects of mental illness. One of the primary uses of escitalopram is in the treatment of depression. This is a condition that affects millions of people worldwide and can profoundly impact a person's quality of life. By increasing the availability of serotonin in the brain, escitalopram helps to alleviate the symptoms of depression, offering hope to those who suffer from this condition. In addition to depression, escitalopram is also used to manage generalized anxiety disorder, a condition characterized by excessive, uncontrollable worry about various aspects of life. Again, by modulating the balance of serotonin in the brain, escitalopram can help to quell the storm of anxiety, allowing individuals to live more fulfilling lives. Yet, it's important to remember that like all medications, escitalopram comes with potential side effects. These can range from mild, like nausea or dry mouth, to more serious issues such as sexual dysfunction or increased risk of suicidal thoughts. Awareness of these potential side effects is crucial in ensuring that we can provide effective, safe, and patient-centered care. There you have it, a comprehensive guide to escitalopram, an essential topic for your board exam preparation. Remember, understanding these details is key to providing effective patient care in psychiatry.